Yes, thank you for having me. The main trials that are very exciting that were presented here at ASCO and I believe is going to change the standard of care. The first trial was a phase 3 trial comparing VTD to dara VTD in patients with newly diagnosed multiple myeloma, and it highlights the importance of using quadruplets in the front line. And this trial showed a progression-free survival advantage and even hinted toward an overall survival advantage in newly diagnosed patients. So this shows that the road is going toward using quadruplets in the first line rather than triplets. The other very important study, I believe, is for patients with high-risk smoldering myeloma. This patient, the standard of care for now is just observations. And there was a phase 3 clinical trial that was presented that showed a progression-free survival advantage for patients who were treated early. Patients with high-risk smoldering myeloma receiving lenalidomide showed improved survival compared to patients with, improved progression-free survival compared to patients on observation. Another important study, I think, and it's mainly important for patients, is subcutaneous daratumumab versus intravenous daratumumab, and it showed that similar safety and efficacy. And I think it is very important for patients because it reduces the time of infusion from 7 to 8 hours to maybe 5 to 10 minutes of injections. So these are very important trials, I think, that may change our standard of care and approach to patients with multiple myeloma. Yes, so yeah, as you said, disparities in care is very important in any type of disease, in any type of cancer, and in multiple myeloma especially. Patients with multiple myeloma now live very long due to very good drugs. However, these drugs are very expensive, and there is disparity in patients whether they can afford these drugs or not. We looked at 118,000 patients with multiple myeloma from the National Cancer Database diagnosed between 2005 and 2014, and we looked at their survival according to their insurance status. Looking at patients age 65 and above, we saw that patients with private insurance had better survival than those with Medicare. Now, looking at confounding factors and the variables that may affect this difference in survival, we found that patients who lived in higher median income regions had better survival than those living in lower income regions. So the median income of the patients is affecting their survival. The other thing that we saw is that patients who are treated in academic institutions had better survival than patients treated in community hospitals. So this is very important for us to understand these disparities and trying to find a way to close this gap, either by reducing the cost of the medications or for academic institutions to see what's the main difference between community hospitals, and if it is mainly the access to clinical care or transplant, we need to help our community hospital to have the same access for transplant and the same access for clinical trials.